Hey, so I'm so glad I ran into you today. I think I've got a project that you're going to be interested in hearing more about. You know, 1 in 8 of our Kern County residents are elderly, and of those that are over 65, 10% suffer from dementia. Our community has a huge lack of awareness and resources available to care for this elderly population incapacitated by dementia. And because of this, we're seeing that, demented are coming into our ED by law enforcement because friends and neighbors are calling 911 for help. And we're seeing an influx of this type of patient into our ED brought inappropriately on psychiatric holds. And then our psychiatric team comes down, drops the hold because dementia is really not mental health. And now in our ED sits an at-risk elderly person with dementia that's not safe to care for themselves, can't go home, and has no safe plan of transition. So as a major public provider of healthcare in Kern County for the indigent and at-risk populations, I think we as a public hospital have an obligation to do the right thing and work towards finding a community solution. And I think even on a more personal level, we as human beings really need to care for those that can't care for themselves. And I think helping our elderly due to dementia is a worthwhile cause. What I'm proposing is twofold. I think first, we need to partner with a residential care facility capable of caring for the elderly that have dementia and temporarily provide short-term placement for them in a safe setting. We'll work with community agencies and partner with them to secure a permanent benefit and housing solution on their behalf. And secondly, I think we need to partner with the Department of Aging and Adult Services and launch an educational campaign directed at working with the community so they can access resources that are available proactively and pre-plan before the elderly and their caregivers are in a crisis situation. I think providing a safe, secure housing option for those that end up in the emergency room in crisis is important. Typically, these patients are ending up socially admitted upstairs in the inpatient units. They're staying for up to 30 days at a time, and the hospital isn't recouping any of that loss because the insurance plans are not paying for that care. I've done a little research, and I think we can lease an appropriate bed at a residential care facility for about $2,200 a month. I think we should lease 4 beds with an annual cost of about $100,000, and if we are able to place these patients in these residential beds instead of our inpatient beds, the return on investment should be about 25-to-1 in savings. We benefit and the patient benefits from safe, secure housing in the proper setting while we work out a long-term solution. I think the educational campaign has even broader effects because those will impact countless lives and people that are struggling with dementia and those that want to help someone with a disease. Some barriers that I see maybe could be some funding, where we're going to pull the funds from. I think we also need to make sure that we don't become the end-all be-all solution in the community for everyone that's in crisis. And also we need to make sure our partner agencies are willing to devote staff and time to the cause. So think about what we're talked about. I'll work with your secretary and set up a meeting later in the week for us to discuss the proposal in length, and I'll talk to you soon. Have a good day.